Thank you very much for bringing together all these wonderful women. It's certainly a different picture than we saw when Washington talked about women's health a couple of months ago, so thank you very much.
There's no where are the women questions here.
Right. Just to give you a little brief explanation of who the YWCA is and why we're concerned about women's health is we are the oldest and largest women's membership movement in the world. We're 150 years old. We're in 125 countries here in the United States. We serve about 2 million women, and 10% of those women are served here in the state of New York at about 250,000 women. Women come to us at all stages of their life. They come to us to be community leaders, but they also come to us in times of crisis. We are the largest provider of domestic violence services and sexual assault services across the country. So women's health has always been a major part of our mission. Our mission is the elimination of racism and the empowerment of women. In order to be a YWCA, you have to have programs. In order to put our sign on your building, you have to run those programs. We're very proud of the fact that we are among the first in a lot of areas. We've been part of the we're not only a social services agency, we are a social movement. And we're very proud of our long history in regards to that. I will be brief. To speak specifically about women's health, like many of the speakers before us, we are deeply disturbed with the attitude around women's health in this country. We are not only disturbed, but we are angry. We are angry that we are still having these conversations about women's health and access to services. We are equally concerned about the impact on low-income, underinsured, and uninsured women in this country and in this state. And we are angry about the fact that some people continue to put politics above the lives of women and force their religious beliefs on all women. We're very concerned. I'm going to speak specifically to access to breast and cervical cancer screening. It remains a major program for us at the YWCA. We screen probably over 10,000 women across the state of New York for breast and cervical cancer. Those are women who live with us. They live in our shelters, they live in our housing, and they come to us through our daycare centers, so we are a point of access. I'm going to share with you my own personal story around screening. I was faced not too long ago with the fact that my employer didn't have health care coverage, and my COBRA was running out. At the same time, I found a lump in my breast. I'm a single mom with 2 kids, and I very seldom share personal stories when trying to make a point, but I think this illustrates very well. I'm not low income, but I'm one of those women who was in that little crack that said, do I do what I need to do for my health, or do I make the decision to spend my money in another place? Women shouldn't have to be making those decisions. We shouldn't be making the decision about whether or not I get screened because I can't afford it. So I just wanted to share that personal story. And still, I think back when I would just walk and think, if I just break my leg, I'm done. I'm financially ruined. Specifically about Senate Bill S. 841 and 6603, it goes a long way to alleviate those concerns by eliminating the copays for most screenings, and women won't have to make those terrible choices about their health or whether or not they pay their electric bill. The YWCA would be remiss if we didn't talk about the racial disparities within the healthcare system. In a study by the American Cancer Society, we know that the facts are that minority women are less likely to have a yearly mammogram. We know that among women with early breast cancer, ethnic and racial minorities are 20 to 50% less to receive appropriate treatment. We also know that African American women are less likely to receive standard treatment for cancer even after adjusting for socioeconomic status. Minority women are more likely to delay follow-up and treatment care, resulting in poorer outcomes. African American women experience a 5-year survival rate of 76% after breast cancer, and white women at 90% due to lack of early detection. The YWCA believes that access to affordable screening will do a lot to prevent worse situations for women of color as well. As a society, we really have to address those problems. These bills go a little bit in ways to do that. We believe there are bigger issues that need to be discussed when it comes to access to affordable health care. Thank you.
Thank you so much.